So here guys we will start the chapter specific coding guidelines. So in that chapter specific coding guidelines we will see the first chapter, certain infectious and parasitic disease. The code series A002B99 and U07.1 and U09.9. These two codes is separate. So in that the infectious and parasitic disease chapter we will see the first HIV positive condition for HIV infections. So what cases we will code HIV infection as Z21 R63.7 and B20. So first we will check code only confirmed cases. Confirmed cases it means what? So in the medical record mention HIV infection or AIDS, that time we will code B20. Second one is the selection and sequencing of the HIV codes. So how to select that? So HIV disease, I am telling you right now, AIDS and HIV disease or HIV infection disease is mentioned in your medical record or patient details. That time we directly code B20, not coded Z21 because B20 is the confirmed diagnosis. So second one condition is patient admitted for HIV related any condition. So patient admitted from the HIV related any condition, that is the symptomatic condition. Sometimes the patient having the AIDS and that time having some symptoms. So if you know that this is the HIV related symptoms, that time we will code B20 directly. So third one is patient with HIV disease admitted for unrelated condition. So patient is admitted from the AIDS or HIV disease. That time their symptoms is unrelated to the AIDS or other symptoms forms. That time we will code B20 and secondary their symptoms because it's unrelated to the AIDS. Fourth one, patient newly diagnosed HIV disease. So for example, patient coming to hospital and doctor diagnose directly this is HIV disease. So that time also we will code the B20. Asymptomatic HIV disease or HIV virus, that is human immunodeficiency virus. So here HIV positive word, HIV test positive or similar terminologies, only HIV mention or asymptomatic HIV mention. That time we will code only Z21. And having the confirmed condition, you know, HIV disease or HIV disease or AIDS or symptomatic HIV, that three conditions you found in your record, that time we will code B20. Other else, if mention HIV positive, HIV test positive or asymptomatic HIV, that time we will code Z21. Sometimes patient come in the hospital and doctor says you are followed with the lab. That time inconclusive HIV serology found. So we will assign the code R75. This code is for inconclusive laboratory evidence of HIV. So next one is previously diagnosed HIV related condition. So I am telling you one example how to you know which code you can find in the record. So previously patient having the AIDS, you got my point. Previously patient having AIDS, but today encounter patient come for the HIV. So in that case we will code B20 only because already patient suffering from the AIDS disease and it's a lifetime condition. That's why we will code only B20 here. So HIV infection in pregnancy, childbirth and purebrum. So here code series is different in the pregnancy coding. That time we will code 098.7. That is human immunodeficiency disease complicated into pregnancy, childbirth and purebrum. Okay. As well as this is the combination code in the pregnancy or infection code in the pregnancy. So we will additional code reported here B20 also because it's a complication in pregnancy, so we will complication code here mention as well as which complication is there. So B20, this code also additionally reported in your record. Next one, encounter for HIV testing. I am already telling you, if the patient without sign and symptoms is tested for HIV, assign code Z11.4. This is the screening code. I am giving you example. Patient comes in a hospital to know I am HIV positive or not. That time doctor suggests the patient you go and check your labs. That time we will assign the code Z11.4. It means encounter for screening for human immunodeficiency virus. Patient no not known is HIV positive or not. He having some confirmatory doubt. That's why patient comes to hospital. That time we will assign code encounter for screening. Also, doctor counseling code also mentioned. So Z71.7 also we can code in that case because provider counseling you can go and check your labs. So this is a counseling. That time we will Z71.7 also we can code it. So next condition is HIV disease and HIV positive state managed by the antiretroviral medication. So patient with documented HIV and HIV related illness is currently managed by the antiretroviral medications. So that time we will assign B20 because patient already suffering from HIV disease or AIDS. Here guys I will show you HIV disease code B20 and AIDS also code B20 and HIV related any symptoms or illness also mentioned, that's code also B20. That's why I am telling to you continuously B20 B20. Okay. So here also antiretroviral medication treated or managed for AIDS, but we will code B20 here. And other code is Z79.899 because it's maintained by the antiretroviral medication. The code description is other long-term drug therapy may be assigned as an additional code to identify long-term use of the antiretroviral medication. So last one condition for the HIV prophylaxis measures. Prophylaxis it means dummy medication. Sometimes patient having continuously telling I am HIV as I am falling in HIV or I am suffering from HIV or AIDS, that time doctor or provider giving the dummy medication. So it's the prophylaxis condition. It's the not confirmed condition. That time we will assign the code Z29.81. This is the encounter for HIV pre-exposure prophylaxis. Prophylaxis is not a confirmed diagnosis. So here first part we will cover in the HIV or AIDS, all condition and all scenario we will cover in that section. So next one is a small part, infection agent as a cause of disease classified to other chapters. It means this is the AIDS is complicated to the immune deficiency for infection agent. For this is the infection agent. It means staphylococcus, staphylococcus, streptococcus, enterococcus. That all the infection agent that's having also low immunity in human body. And here infection resistant antibiotics, that's the treatment for the that condition or HIV condition, that's having also code Z16, that is the resistance to the antimicrobial drugs. So here we will cover all HIV related scenario and their other infection agents and their treatment conditions. So next part we will see the sepsis guidelines in detail because sepsis is very important in ICD 10 So we will see in the next session. Thank you so much.